Discovered that he did this xenotransplantation like 30 years ago, and I find it quite fascinating that a doctor like him 30 years ago did something when the Americans, the US, did it 30 years after. So it was really great to see his amazing work in that time.
নতুন জীবন দিলে মই ধন্যবাদ জনাবলৈ কোনো ভাষা নাই। ভগৱানৰ প্ৰাৰ্থনা আৰু আৰু কিবা আৱিষ্কাৰ কৰে, অকল মোৰ নিচিনা ৰোগীক জীৱন দানেই নহয়, তেওঁ বহুত কিবাকিবি আৰু আৱিষ্কাৰ কৰিছে, যেনেকৈ চুগাৰৰ ট্ৰিটমেণ্ট, HIV ট্ৰিটমেণ্ট, এইবিলাক মই বহুত কেঞ্চাৰ পেচেণ্ট বহুতখিনি সুস্থ হোৱা দেখিছোঁ, মোৰ তৎকালি সুস্থ হোৱা দেখিছোঁ।
Feeling better and comfortable.
So the pacemaker is all about the implantation. Bypass surgery and this pacemaker implantation is an outdated procedure told by Dr. Dhani Ram Baruah. The thing is that we treat patients with injection therapy. We have demonstrated to patient. The thing is that they are living a very normal life without injection therapy. They don't need any surgeries, do nothing. Only injection they need, because pacemaker, when they implant pacemaker, the thing is that their life is become very miserable. They can't go for like electronic devices, big currents, even lightning and thunder. When it happens, it's very miserable for the pacemaker patients. The life of them remains very afraid limits. The thing is that and the bypass surgery patient, they don't need any operations or surgeries. Now they are leading a very normal life nowadays. Now you can check out all the testimonials of the patients in our YouTube channel, Dr. Baruah Heart City. You will get it there. Every patient we have been given there, the testimonials. Yes, that's the thing.
You've talked about the edible plants that are used for the injection. Can you tell us more about it?
Yeah, this is extracted from edible medicinal plants through genetic engineering. And she is the mother of all the molecules. So she should speak about this.
About the plants, which plants, how many plants?
We cannot disclose the particular plant which we are using, but the other plants are available now. Like in Assam, they are more. They like Bhaverilata, Manimuni, Masundari. These all medicinal plants are there, but you people are not using it. We have extracted medicine from edible medicinal plant, and these medicinal plants we have isolated some biomolecules which are properly isolated, extracted in pure form, and they are working very nicely in case of heart diseases, diabetes, SLE, HIV, cancer. If cancer patients coming at the earlier stage, they are getting cured with our medication.
And how many injections are being injected during the process?
It depends what type of disease and what is the severity of the disease. Accordingly, we will decide.
Like in heart diseases, we take a period of like 6 months. The 6 months is the minimum period, and the maximum period is like 9 months. The patients get cared within this period. And now I talk about that HIV also. Only 10 injections for the whole lifetime. No medicines, nothing. What I'm only 10 injections they get cured. Means we inject the injections, and this we inject artificial antibodies. Artificial antibodies are injected inside the body. With the normal antibodies, they get attached and it's fight with the virus. That's the thing for HIV. Even the cancer has a period. Like until and unless we kill the cancer, the process goes on. Even the heart diseases, the process goes on until we have cured the thing. Means it's a very minimal cost, nothing you have to give it. Like if you go for like bypass surgery, you have to go for like 10 lakhs or 15 lakhs something. But in our case, it's more than like 2 to 3 lakhs for the whole lifetime, nothing else. And moreover, I want to say one thing to this xenotransplantation, because US has taken the Nobel Prize. I just want to say Dr. Baruah has done back in 97, for which he have to get. So we are writing a book. It's a reply to United States of America that he should get it, because he got a very infected patient back that time. And US got a very, I don't know the concept of US.
According to reports, it was due to the transplant that he got the infection, the patient.
The patient is already infected from
No,
that.
2000, we have operated him on 15 December 1996 first, and he was already infected.
Yeah.
That time we treated him for a number of antibiotics.
And the anticoagulant
It was
agent.
not, that time it was not a transplant, it was a open heart surgery with VSD we have done. It's a wrong concept people have got.
Exactly.
Yes.
But then it is now like a stereotype that if patients go to him, then he might also go through the same fate that the patient has gone. So it is like a stereotype.
A stereotype, correct, yeah. That's the main.
So you guys are working to break that stereotype.
That stereotype means the book is not to get the Nobel Prize or something. We need a doctor like Dr. Baruah, scientists like him, so that they can do the process and make it happen. Because he got an infected patient, and if someone get a clean patient and go with the same process, I think the patient will be alive for like 10 to 15 years. Like US has done, like for 22 years back, 22 I guess, or 20 something like that, and they have kept alive only for 2 months. Why can't they do it, na?
Their concept was different, and our concept is totally different and very simple procedure we are adapting. That's why we were successful, and we would have been successful throughout, means this thing, and xenotransplantation would have been very successful by this time. And if Dr. Baruah would have allowed this procedure, but it was unfortunate that he was restricted with the procedure.
And I just show this book also. One second. This book is used as a reference book in Stanford University. So this is the book. Why not Indian universities goes for this, do research about this? That's the thing. It's a minimal cost of like 2 to 3 lakhs or something. Nothing else. Nothing you have to give. One-time treatment. You don't have to come back to us. You get relaxed and you go to your own homes.
Actually, bypass surgery, when you do, you have to do double operation. One, your open heart surgery, and one, you have to remove your artery. That is the radial artery or internal mammary artery or saphenous vein, whatever it is. But Dr. Baruah's therapy, we don't go for operation or nothing. And double surgery expenses also you have to avoid.
It's from 6 to 9 months. It's a minimum period of 6 months. Patients get relief. The normal patients get relief within 5 to 6 months. And the patients who are very severe, they take a period of like 9 months, 8 to 9 months. They get very relaxed and
we treat them thoroughly so that they should not come back again further with recurrence.
Do you get any support from the government?
We want support. We want support from government. I hope Dr. Himanta Biswa Sharma, one of the finest Chief Minister of Assam, should come up, discuss this thing and give us support. The support is not like financial or something. Support from the government. Government support is very important, as BJP is doing a marvelous job and something. And I hope BJP government, our Honorable Prime Minister and even our Chief Minister, they should come up. I would love them to give us a guide and everything.
Okay, my last question.
Yeah.
So there are, since there are a lot of dogs near the campus, there are speculations that some kind of experiments are going on with the dogs also.
Yeah.
Do you have anything to say about that?
No, we don't, because the data which we will get from dogs, we cannot apply to humans. So what is the use of doing research on dogs? It's a wrong concept. Even you cannot use monkey or gorilla or chimpanzee because the size of the animal and size of the animal heart and the size of the animal walking and this thing, all these things you have to consider. Why we have selected pig? Because of similarity with human only. So data from dog cannot be transmitted to the human. So we don't use this type of things. It is a paid because we have brought at the initial stage we have done experimentation of pig, goat and other things, monkeys, but not now. We are not doing xenotransplantation was restricted for us. So we do not go, but because of pets and we like it and that's why, and we need protection. We are just living in the isolated area where government doesn't give us support. Only one PSO is given to us. And isolated place, so we are scared. That's why these dogs are with us.
There were reports of attacks also.
Yeah. Yes, number of times. So that's why dogs are kept, and we don't give any dog to anybody because.
So that's the thing, he is an animal lover. Even we have not only dogs, we have pigs, even we had camels also, but they can't survive with the atmosphere or something, so they died. Many things, they have around 100 plus monkeys. There's langurs, everything, this hornbill, they used to come. It's a very beautiful place. The thing is a very natural therapy. We got 2 hills. Within the 2 hills, patients should come up. As I want to say, Dr. want to break this stereotype of hospital concept. They have to come for like relaxation somewhere. Once you get relaxed, you will be all right. That's his concept.
It's like a medical resort.
Medical resort, I would say, yeah, that's the thing. Thank you. Pigs, dogs, monkeys, hornbills, everything is there.